Hey guys, so it's Monday afternoon. I'm Dr. Brandon Bupp at Advanced Health and Wellness Center, and I wanted to give you a little tour. So here's Stephanie,
Hey, buddy.
and this is our front desk. And so when somebody comes in the front door, they're greeted. You can come this way. They're greeted by Stephanie, and typically we know when y'all are coming in. So we're ready for you. She has a file and she has everything ready to discuss with you. Come on this way. So then we'll go through the office and walk through to this area over here. And the first thing that we do is we sit down and we go through a health history, detailed health history. So if you come on in and we'll be sitting here with you. Yep, there's Heather. She's at the desk, at the chair. So essentially, we want to go through and understand your complaints, your initial chief complaints, your health history. Obviously, we have all of this different paperwork that we have people fill out prior to coming in, so we can review that. Our doctors can have looked at what's happening with the case. You meet with typically one of our case managers or the doctor. First, usually we'll meet with one of our case managers, and they'll go through again health history. What kind of problems might the person what the patient might be having? What kind of things have they done in the past? What problems are they still suffering with, or what problems would they like to change or improve? Understand everything that we can about the history of the patient. So it's not just so you can come in and lay down and get adjusted. Like, that's not really how it works here. We understand the steps of what may be happening and what would be going on. And the whole reason for that is because we want to understand where the problem is coming from. So once that's been done, we actually will review with you cost as well. So we look at the beginning up there at the front, Stephanie would get ID information, driver's license, insurance information, whatever that pertinent paperwork would be. And then we actually verify insurance coverage so we can understand what type of coverage, because the name of the insurance company doesn't mean as much. It's really important to understand what that individual person has, what their type of coverage would be, so that we can understand what their costs are. So they would talk to the case manager, talk to the provider, either myself, Dr. Zach, Leah, and we would understand what we might want to do. And so then we go through cost of exam, cost of x-rays, cost of any other thing that might be happening that day, what other treatments we might do. Sometimes we explain some of those treatments prior to, but we want people to understand beforehand what's happening before we do anything. So we get that part done, and then we've agreed on what we're going to do, and we come on over through this way, and we go into our examination room, one of our examination rooms. So we have this table here. We may do some exam information, exam testing here. We also have our digital x-ray. So the x-ray goes from here immediately to this computer. So it's a simultaneous process. We also, like I said, we're understanding more about the person's problem or what they might need. We also do a nerve scan. The nerve scan isn't in here, but we use a thermal, we use EMG. We use heart rate variability, so that test is completed. We do bilateral weight scale, so a patient stands on one side versus the other. For some people, they may come back and do blood work on a different day. We may do other types of testing if it's been determined that would be appropriate for the patient when they meet with the providers. So anyways, that's the first day, and that's pretty much it. Now, if somebody's in pain, we may do some treatment initially. So sometimes we'll do the laser decompression. We may use the PEMF because, again, it's helping to reduce inflammation. They may get adjusted that day once we've established that we should be adjusting them, or that it would be appropriate for us to take care of that patient on that day. Or we'll refer them out to another another place. But typically we'll go through the exam, we'll look at the x-rays, we'll look at the findings of the exam. We'll do some type of treatment initially to see if we can start moving in the right direction and to see how the patient responds with that. And then the person would get scheduled the next time to come in. We go through a detailed report of findings, how often, how long, what insurance covers, what kind of things are we going to do, what's the person's expected expense going to be, and that's it. Then we get started with care. On another visit now, on another video, I'm going to show you some of the different treatments. So we're going to go through this little education process. Again, I want to give you a tour and an understanding of what might be happening here in our practice without you actually having to be here. Call it the COVID free tour. You can watch it on your phone and understand exactly what our practice looks like and what to expect. And if you have any questions, please let us know. Guys, we just are tired. We don't want to continue to see people suffering in pain and doing things that may be invasive or not healthy or potentially not even helpful. And we know that there are solutions, but we got to do this initial preliminary work to find out what we should be doing, what exactly is causing the problem. So that's the foundation for day one. What's causing the problem and what should we do moving forward? That's it. If you have any questions, please let us know. Have a great week.